Jackie was one of the lucky ones.
I was having a scan for something else, and they discovered something on my pancreas.
It was cancer, a rarer type called neuroendocrine pancreatic cancer. Doctors wasted no time getting her into the operating room.
That was Friday, and on Monday I was in surgery.
She had chemotherapy and radiation, and for years the cancer was under control. Then it came back, twice, most recently in 2018. That time it was in multiple places in her body, and surgery wouldn't help. The cancer was progressing despite all the standard treatments. Jackie considered her options, including more chemo, but the idea of going through the side effects again was daunting. Instead, she and her doctor decided to try a new FDA-approved treatment called peptide receptor radionuclide therapy, or PRRT.
I would actually be given a radioactive isotope.
In some people, the cancer cells have proteins on their surface that bind, like a lock and key, to a hormone the body makes called somatostatin. This new treatment takes advantage of that. It's a protein similar in structure to somatostatin, but with a small amount of radioactive material attached.
So you inject the drug, and it circulates throughout your body and only goes to the cells that have the somatostatin receptors and delivers radiation therapy. So it's a selective treatment that is only targeting the areas that have neuroendocrine cells.
First of all, it aggravates and then it annihilates.
Before getting the radioactive treatment, patients get an IV solution of amino acids to help protect their kidneys. Also, hospital staff have to place several coverings to guard the procedure room from radioactivity in case of a spill or contamination with body fluids.
It takes a lot of logistics.
Doctors in Europe were the first to use PRRT and have had success.
We were able to show a substantial increase in overall survival.
Buying patients a little more time, about 2 years. Jackie was the first patient to get PRRT at Allegheny General Hospital.
If I'm the first, I'll probably get a lot of attention to make sure that it goes well, which was good for me. And then also I thought, well, if I'm the first, then other people might be able to benefit from this.
It's a full day, 7 a.m. to 3 p.m. There are 4 treatments total, given 8 weeks apart. After each dose, she must stay away from friends and family for a while.
So my husband and I have to be apart. I sleep in the spare room for a week. I can't be near my grandsons for several weeks. After about a week, they told me that I could be out and about again and go to the grocery store, go to church, do those kinds of things out in the public, but still try to restrict close interaction with people. A temporary inconvenience for a permanent improvement.
Without insurance, PRRT is not cheap.
It was going to be quite expensive, and I didn't know if we would be able to do it. Even with the insurance, the copay was very high. But that has not been an issue since then, so apparently that insurance issue has been worked out.
The main side effects are fatigue, nausea, and bone marrow complications. Jackie really hasn't had any of that, although she did lose a little of her hair.
I am able to drive home after the treatment. The side effects have been minimal. I'm feeling much better. I have more energy.
She's optimistic about her future and hopes PRRT does what it's supposed to do. I'm Dr. Maria Simbra, KDKA News.